Now, the trachea is described as the membrano-cartilaginous tube. These are the membranes and the cartilaginous tube extend from the lower border of cricoid cartilage, C6, cervical 6, it begins. The upper level is the cervical 6, and it divides into right and left bronchi opposite the sternal angle at T thoracic level. C6 to T6. This is the extent of the trachea, and then it divides into right and left bronchi opposite sternal angle. The sternal angle is at level of thoracic 6 vertebra. Slight deviation to the right and its termination. Slight deviation to the right, its termination. 16 to 20 cartilaginous rings are and trachealis muscle. These are the cartilaginous rings and the trachealis muscle and the posterior aspect in front of the vertebra from C6 to T12. Now, this is the carina surrounding the commencement of two bronchi. Relations of the shape of the trachea: arterial supply, inferior thyroid artery, and bronchial artery at its bifurcation. Inferior thyroid vein, venous drainage, inferior thyroid vein, lymphatic drainage, pretracheal and paratracheal lymph nodes. Now the pretracheal and paratracheal lymph nodes, nerve supply parasympathetic from vagus and recurrent laryngeal nerve, sympathetic from upper 4-5 thoracic segments. Now the right and left bronchi enter the hilum, dividing into two smaller bronchi, reaches lung via respiratory bronchioles. Right bronchus is wider and more vertical than left, divided into extrapulmonary and intrapulmonary part. Now extrapulmonary part of bronchus, that is right side reaches the hilum at the level of T5. This is important. Right side reaches the hilum at the level of T5. Epiterial bronchus, hypoterial bronchus. Left side reaches the hilum at the level of T6. This has only hyperarterial bronchus. Epiarterial and bronchus and hyperarterial bronchus, and in the left side only hyperarterial bronchus. Now, intrapulmonary part of lung, principal bronchus, secondary and tertiary bronchus. The tertiary bronchi to the upper lobe, apical, posterior, anterior, and lateral and medial, anterior basal and lateral basal, and posterior basal. This is the apical and the medial basal. Lower branch is the middle lobe and lateral. Now middle lobe syndrome, upper part of the lower supplied by. Now intrapulmonary part of left lung, upper lobe bronchus is into ascending and descending, ascending and descending, ascending into 3 apical, posterior, anterior, tertiary bronchi, and descending into 2 superior and inferior. Now lingular bronchi and lower lobe bronchus into 4 tertiary bronchus, anterior basal, medial basal, and lateral basal and posterior basal. Now this is important, bronchopulmonary segment, a portion of the lung aerated by each tertiary bronchus accompanied by a branch of pulmonary artery, segment separated by intersegmental areolar septa having tributary of pulmonary vein. Bronchovascular unit, it is an independent respiratory unit, 10 bronchopulmonary segment. Now this is a short note. You will get a short note on bronchopulmonary segments. Now this is the pictures of the bronchopulmonary segments. See upper lobe, apical, posterior, anterior, middle lobe, lateral, medial, and lower lobe, 6, superior, medial basal, anterior basal, lateral basal, and posterior basal. This. Now, this is the alveolar sac, alveoli, respiratory bronchiole. This is the bronchiole, pulmonary arteriole, and elastic connective tissue. Visceral pleura. This is the visceral pleura. Applied anatomy. Natural drainage of infected material by adopting different postures. Fibroareolar septa acts as a natural barrier except in carcinoma. Apical segment of the lower lobe and posterior segment of the upper lobe, lung abscess. These are the common for lung abscesses. Apical segment of the lower lobe and posterior segment of the upper lobe. Lung abscess. Fibroareolar septa acts as a natural barrier except in carcinoma. Natural drainage of infected material by adopting different postures. Fibroareolar septa act as a natural barrier except in carcinoma. Lung দেখানো হয়েছে ইয়েতে স্পেসিমেন দেখানো হয়েছে হ্যাঁ ডিসেকশনে তাহলে তুই যে সেটা রিভিশন হোক Now, the right lung, you can see this is the medial surface. This is the hilum of the lung. And see, this is the posterior border, this is the anterior border, this is the base of the lung. Similarly, this is the left lung. And you see this is a left superior pulmonary vein, left bronchus, left inferior bronchus vein, and diaphragmatic surface, the base of the lung. Now similarly, right superior bronchus, right middle bronchus, and inferior intertube node. This is the node, lymph node, and this is the vein, and this is the artery, this is the diaphragmatic surface. Now, relations of the lung. See the trachea, and the heart is there. This is the left subclavian artery. This is the recurrent laryngeal lung. This is the vagus nerve. This is the apex of the heart. This is the coronary artery vessels. Now, azygous lobe of the lung can come as just a short note. Now, accessory or supernumerary lung. 3 types: upper azygos, lower azygos, lobe of the azygos vein. Lobe of azygos vein affect the upper lobe of the right lung. Apex splits into medial and lateral parts. Arch of the azygos vein suspended by pleural septum from bottom, and medial part of the split apex forms lobe of the azygos vein. Now pulmonary vessels, each lung provided with one pulmonary artery. Arterial branches follow the division of bronchus. Pulmonary artery supplies nutrition to the respiratory part. Each lung presents two pulmonary veins, the upper and lower. Now pulmonary vessels can be a short note even. Nutrition of the lung, conducting part up to respiratory bronchioles supplied by bronchial arteries. Right lung has one bronchial artery and left two bronchial arteries from descending thoracic aorta. Now bronchial veins, this is important. Conducting part up to respiratory bronchiole supplied by bronchial arteries. Right lung has one bronchial artery, whereas the left has two bronchial arteries from descending thoracic aorta. Now bronchial veins, superficial veins drain into the arch of the azygos, into right heart, and deep veins terminate into pulmonary veins into the left atrium. Lymphatic drainage, superficial set and deep sets into bronchopulmonary lymph nodes. Lymph flows into superior and inferior tracheobronchial lymph nodes, forms bronchomediastinal lymph trunk, draining through the thoracic duct. All lymph go through the thoracic duct and right lymphatic duct. Nerve supply, anterior and posterior pulmonary plexus, formed by parasympathetic and sympathetic nerves. Parasympathetic is bronchoconstrictor and sympathetic bronchodilator and vasomotor. Now, bronchoconstrictor, you have severe dyspnea, COPD, chronic pulmonary disease, and the parasympathetic is a bronchoconstrictor and sympathetic is bronchodilator and vasomotor. Now, this is trachea's description. Membranocartilaginous tube extends on lower border of cricoid cartilage, C6, divides into right and left bronchi opposite sternal, T6, T6, and slight deviation to right is its termination. 16 to 20 cartilaginous rings and trachealis muscle. Carina surrounds the commencement of two bronchi. Relations of the trachea. The arterial supply, inferior thyroid artery, bronchial artery at its bifurcation. Venous drainage, inferior thyroid vein, lymphatic drainage, pretracheal and paratracheal lymph nodes. Nerve supply, parasympathetic from vagus and recurrent laryngeal nerve. Sympathetic from upper 4 to 5 thoracic segments. Right and left bronchi. Right bronchi enter hilum, dividing into smaller bronchi. Reaches lung via respiratory bronchioles. Right bronchus is wider and more vertical than left, divided into extrapulmonary and intrapulmonary part. This can be a short note. Extrapulmonary part of bronchus, right side reaches hilum at level of T5. Epiarterial bronchus, hypoarterial bronchus, left side reaches hilum at the level of T6. Has only hyperarterial bronchus. Intrapulmonary part of the right lung, principal bronchus, secondary and tertiary bronchus, 3 tertiary bronchi to upper lobe, and lower branches to the middle lobe, medial and lateral, middle lobe syndrome, upper part of the lower and supplied by intrapulmonary part of the left lung, the upper lobe, lower bronchus into ascending and descending, ascending into 3 tertiary bronchi and descending into 2 lingular bronchi. Lower lobe bronchus into 4 tertiary bronchi. Now this is important bronchopulmonary segment. Portion of the lung aerated by each tertiary bronchus, tertiary bronchus and accompanied by branch of pulmonary artery. Segment separated by intersegment areolar septa having tributary of pulmonary vein, bronchovascular unit. It is an independent respiratory unit. 10 bronchopulmonary segments. These are the bronchopulmonary segments. This is the respiratory bronchiole and the trachea and the pulmonary arterial. This is the alveolar duct, alveoli, alveolar sac, pleura. Now, natural drainage of infected material by adopting different postures. Fibroareolar septa act as a natural barrier except in carcinoma, apical segment of lower lobe and posterior segment of upper lobe lung abscess.